Good afternoon and welcome to our Bridge the Cliff Town Hall here at Step Up Savannah. We're very excited to welcome our partners from the Georgia Budget and Policy Institute, Livewell Erie, 9 to 5 Georgia, the New Hampshire Department of Health and Human Services, and Atlanta Fed Advancing Careers Initiative. Step Up Savannah is committed to partnering and to share information around economic inclusion to our community. Established in 2008, originally as a poverty reduction initiative with the city of Savannah, Step Up Savannah now operates as a standalone nonprofit agency that not only offers direct service programming, but also acts as an advocate, a convener, a collaborator, a capacity builder, and our work addresses the many complicated issues around economic inclusion here in our region. We believe that a beloved community is where all people have hope and opportunity, and where we can challenge injustice, and where all community members can step up to be a more inclusive community. I love what Nelson Mandela says. He says that overcoming poverty is not just a gesture of charity. It is an act of justice. It is the protection of a fundamental human right to dignity and a decent life. And while poverty exists anywhere, there's no true freedom. And so Step Up Savannah is committed to ensuring that we avail ourselves of systems and community level change to make our region more equitable. One of the ways that we know people in low wealth communities struggle is with asset poverty. Essentially, asset poverty means that a family, a working family, may not have enough resources on hand to cover their basic necessities for 3 months, and that their net worth is zero. That means they don't have a 401k, that they don't have a savings account or life insurance or own a home. And we know that asset poverty is something that the entire country is dealing with on many different levels. Here in Savannah, our asset poverty level among households of color runs as high as 43.5%. And in some neighborhoods, that can go as high as 50. And so our work with our partners, again, is to advance systematic, sticky solutions that help afford these families a way out of asset poverty and create bridging capital across the social safety net so that they can effectively and efficiently enter into the economy and connect themselves and move themselves from economic insecurity into economic mobility. And so we're very pleased today that as a part of our work, we have searched and scoured the nation and continue to do so looking for best practices that we can lift up and that we can share in hopes of solving this issue, not only regionally, but nationally. And so we are pleased to present this learning opportunity with a cohort of national subject matter experts around the public benefits cliff. And to share more about this, this issue, I'll now turn it over to our public benefits manager, Kimberly Polk.
Thanks so much, Alicia. So now we're going to transition into defining the public benefits cliff a bit. So the public benefits affects many experiencing the asset poverty. And the public benefits cliff is when an individual is ineligible for public benefits, but has insufficient income to cover their essential living expenses. Here's an analysis that we did on a few benefits cliffs in Chatham County. So we used our average children rate of 2.5 children per household, so that's about 3, and showed an analysis for 1 adult and 2 adults. The red bracket there emphasizes the income comparison between asset poverty and 100% of the federal poverty limit. Further, the average monthly income in Chatham County is about $4,199 for $1 for 1 working adult, and then 2 working adults would be an average of $8,398, which is still lower than the cost of living in Chatham County. And the difference of that cost is exemplified by the red dot there. This chart does not show the additional requirements such as priority groups, approved activity, and citizen status, which creates additional barriers. Further, these are examples. We could show others with housing, utility assistance, TANA for cash assistance, WIC or women, infant, children. However, the bottom line is the federal poverty limit is much lower than Chatham County's cost of living. Also, with inflation, it is likely that future analysis will show an increase in the livable wage with little increase in the federal poverty limit. So who experiences the public benefits cliff? This is twofold. So there's those who are already receiving public benefit assistance and those who are eligible for public benefit assistance. Those already receiving public benefits, this cliff is experienced when households are currently receiving public benefits and have an opportunity for financial promotion. However, the promotion will often exceed the federal poverty limit, making them ineligible for public benefits. Thus, they will most likely lose their valuable food, childcare, and health care public benefits assistance. There's also those that are already ineligible. Though above the federal poverty limit for public benefits, they still experience a lack of access to resources needed for economic mobility and self-sufficiency. So why does this occur? So current policy doesn't consider the actual cost of living and thus perpetuates poverty by ignoring the fact that the federal poverty limits do not consider the actual needs of individuals. There's also a lack of transitional benefits in our community. Either you have benefits and you're in poverty, or you don't receive them and you're not in poverty. That's what the idea is. And so the system, as a result, is very dichotomous. There's also rigid requirements. There's unrealistic work requirements, asset limits, and then there's a limited scope of what actual expenses look like. Further, there's also a lack of access to services that bridge the poverty gap while folks are on this road to self-sufficiency. So a lot of services such as education, food, childcare, healthcare that could be transitional have the same federal poverty limits as the public benefits. And they're income-based as well. And then those programs often do not take and consider the net worth. So the consequences is that household members will avoid economic promotion because of the fear of losing food, childcare, and healthcare resources. It encourages and perpetuates generational poverty. The government pays out more money in public assistance. However, if financial stability and growth was encouraged, they would pay less over time. So today, this is our effort to bridge the cliff together with a lot of our multiple partners throughout the US. So in Georgia, we have the Georgia Budget and Policy Institute that works to advance lasting solutions that expand economic opportunity and well-being for all Georgians. They produce research and state budget analysis to show Georgia ways to provide equitable education, healthcare, and opportunity for everyone. We also have 9 to 5 Georgia, that is a nonprofit organization working for economic security, gender and racial justice, paid family and medical leave, workplace rights, and safe housing. Also in Georgia, we have the Atlanta Fed's Advancing Career Initiative, which seeks to improve economic mobility and resilience by helping to eliminate barriers to career advancement caused by the loss of means-tested public assistance and financial insecurity. We also have partners from other states with us. First, we have Livewell Erie. That is a broad-based, data-driven initiative involving numerous partners in the public, private, and nonprofit sectors. They're collaborating to achieve greater health outcomes and improve the overall quality of life for its residents in Erie County, New York. And then last, but certainly not least, we also have the New Hampshire Department of Health and Human Services that joins communities and families in providing opportunities for citizens to achieve health and independence and to meet the various needs of its citizens. So now I'm going to turn it over to Ife to talk about the benefits cliff and SNAP.
Thank you so much, Kimberly. Good afternoon, everyone. My name is Ife Finch-Floyd, and I am a Senior Policy Analyst for Economic Justice at the Georgia Budget and Policy Institute. Today, I'm going to focus my remarks on SNAP, or the Supplemental Nutrition Assistance Program, and show an example there. But before I move on to my next set of slides, I want to build upon a little bit what Kimberly has already laid out about the benefits cliff. Really, there's two big ways to address the benefits cliff. You could either reduce benefits at lower levels of earnings or income, making people ineligible while they are still experiencing significant hardship, right? So you're narrowing access to public benefits, or you can extend them. Right, you can extend them further up along the income scale, so higher levels of earning or higher levels of income, and that's the other way to address benefit cliffs. But it's not really. Certainly, you can develop, certain schemes, and those can look differently. But those are generally your two options in addressing the benefits cliff. And I want to add one more point. A lot of public surveys nationally asking people's opinion about safety net programs like SNAP, or also known as food stamps, or cash assistance, right? People think that these programs should only be available when people really need them, right? They should not be available for the long term. But sometimes that comes into conflict when you meet with the reality of people's circumstances and the benefit cliff. Right. So again, I told you there are those two options to consider. You can either reduce benefits, or you can extend them to help people gradually maintain support as they begin to earn more. But sometimes that can maybe come into conflict with the public's belief about what the safety net should be. So I just wanted to offer that to say that these are really challenging questions for us to consider. Okay, so this is just a snapshot. This is very similar to what Kimberly showed you before, but what I have here are the wages, hourly wages for a single adult raising 2 kids, and I'm going to use that family structure for each of my slides, so keep that in mind. But just to give you a snapshot of the state of Georgia, Chatham County, and Bryan County. So the living wage, as Kimberly referenced earlier, that's how much people need, again, for a 3-person family to really meet all their needs. And you can see kind of the different areas and regions, what that looks like. And then we had the hourly wage, what people are generally making. But again, that's an average. So certainly some people are making more and some people are making less. And then we have the hourly wage for the gross income limit, or the max income that a person can have and still remain eligible for SNAP. And you can see that's around almost $14. And then you see, as Kimberly was talking about, the poverty wage is much lower, but still some people are making that. And then we have a federal minimum wage that's even lower, and a state minimum wage that's even lower. So this is just a snapshot. You don't have to memorize this, but just to keep it in mind as we continue to talk about the SNAP benefits cliff. Again, this is just context. So this is from MIT's Living Wage Calculator. This is the annual and the monthly costs of food. Now, it's not adjusted by family or household size, but still you can see for any type of family, this is quite a bit, right? More than $7,000 a year and more than $600 a month, right? For the cost of food for a family. So that's a huge chunk out of anyone's monthly budget. So I want to make sure everyone is on the same page when talking about SNAP, or the Supplemental Nutrition Assistance Program. So this is a predominantly federally funded nutrition assistance program that serves tens of millions of people in Georgia. But it helps people afford the cost of food. And again, those benefits are mainly funded, are completely funded by the federal government. So Kimberly also mentioned there are a number of things that may make an individual or a family eligible for public benefits like SNAP. I'm just going to talk about the income tests related to SNAP eligibility, because they are extremely important when considering the benefits cliff. So there are 2 income tests for SNAP. And the first is what I referenced before, and it's that gross income limit, or the maximum income you can have and remain eligible. So that's no more than 130% of the federal poverty line, which for a family of 3 is about just shy of $2,400 a month. And that's except if you don't have an elderly or a person with a disability in your household. Then the net income is the second income test. So the net income is what you have left over after, caseworkers at the state consider your housing expenses, your childcare expenses, out-of-pocket medical expenses, and I think even utility costs. Some of the key expenses people have to take care of in order to make sure they have their basic needs met. And it lowers, the net income is what you have left over. So that net income has to be no more than 100% of the federal poverty line, which is still not a lot. But for a family of 3 is about $1,800 a month, a little bit more than that. Okay. So what I'm going to do in this slide and the next slide is just show an example of kind of trying to visualize an example of what the benefits cliffs look like and what the impact can be after just a small increase in monthly earnings. So if we look at the bar to the left, we see a family earning right at the max gross income, and then their net income keeps them eligible, right, at the 100% federal poverty line. And so they still receive a fair amount of SNAP benefits. Oh goodness, some of the amount was left off, but it's still just a couple of $100 in SNAP benefits. But you can see if a person just earns an additional $160 a month, so a very small increase in wages, right? Yes, their earnings have increased, but their overall income has now dropped. And that is the cliff that Kimberly was talking about. They still have the same high costs of rent, affording childcare, but now they have less income to address all of their basic needs. And again, I'm just taking into account SNAP and earnings, right? Obviously, some people may have different sources of income, but I'm just kind of taking into account those 2 things. So this next slide assumes we have a higher gross income limit, moved up to 150% of the federal poverty line. So this kind of shows how a person can continue to earn a little bit more and still maintain SNAP benefits. So the first bar, again, is kind of the status quo, what we have here in Georgia now. And the second shows what would happen if the gross income limit were to increase. Now, let me pause here. I should have actually started with this. States actually have an option to increase the gross income limit. You'll hear from other states that have taken that option. Georgia, in fact, is one of the few states in the country that has not increased its gross income limit. But if we just go up to just, again, 150% of poverty, you can see that a person earning an additional $160 a month, maybe about $48 extra a week, and then increase that to about 320, and then another increase to about 360, you can see that their income is still growing as they're able to maintain SNAP benefits. I do want to be clear, this does not eliminate a cliff. There is still a cliff once a person reaches 150% of the poverty line. Some states extend it above 150% of the poverty line. But what it does allow is more opportunity, one, for a family to earn more, and for caseworkers, either in community organizations or at the state level, to help prepare that family for transitioning off of SNAP. And I think we're going to hear more about that from some other guests today. So I am happy to answer any questions. And if you think of questions after this presentation, you can email me here.
Thanks. Thanks so much, Ife. We're going to take the questions near the end. So save your questions as we move through the presentation, and we will have time for Q&A at the end of the presentation. So next, I am going to turn it over to Miss Erin Clark from 9 to 5 Georgia, who is going to talk to us about their work with childcare and CAPS. Erin?
Thank you, Kimberly. Hi, everyone. I'm Erin. I am the childcare organizer with 9 to 5 Georgia. And 9 to 5 is a nonprofit organization working for economic security for all women and their families. We're fighting for economic justice, gender justice, paid family medical leave, workplace rights, and affordable childcare and safe housing. So we do this work through community organizing, education and empowerment, and people-centered advocacy. And I will be talking about the public benefits cliff as it relates to childcare. So to kind of ground this conversation in some childcare terms that we will be referring to during the presentation, I'm going to define a few of these terms for you all. So licensed childcare learning centers are childcare centers typically operated in non-residential facilities where children are often grouped in classrooms by age, and these centers usually have a dedicated director and staff members. So licensed family childcare is childcare provided in a professional caregiver's home for pay. And in Georgia, this care is provided for 3 to 6 children. And then we have informal family, friend, and neighbor care. So this is a type of home-based care in which a relative, friend, or neighbor provides care. And this can be with or without pay. So to give some background on subsidized childcare in Georgia, first, I'm going to talk about the Child Care Development Fund, and this is a federal and state partnership program, which is administered by states, territories, and tribes. And states use this Child Care and Development Fund to provide financial assistance to low-income families so that they can access childcare to work or attend a job training or educational program. So in Georgia, financial assistance is provided through the Child and Parent Services Program, also known as CAPS. So this program is operated by the Department of Early Care and Learning. And CAPS uses an eligibility model, which is based on priority groups. CAPS currently serves 60,000 children in Georgia, and this is an increase. So generally CAPS serves 50,000 children. Federal relief funds allowed an increase for an additional 10,000 children to be able to receive CAPS. So the CAPS program is intended to help low-income families obtain high-quality childcare, increase children's school readiness, and help families become economically self-sufficient by subsidizing childcare costs while caregivers work and prepare themselves for work through school or training. So while this program is incredibly important for families, its reach is limited. So CAPS is not an entitlement program. So this means it does not serve everyone who applies and is eligible. And the number of people who are able to receive CAPS is limited by the funding. So children must be part of a specific priority group to actually qualify. So there's 13 different priority groups, and I'll go into a little more detail on those later. And this means that only about 14.8% of the children who are actually income eligible for CAPS are able to receive CAPS because of the additional eligibility requirements. Inconsistent work and education requirements also can provide challenges for families and can cause administrative hurdles, which can lead to families losing assistance as well. So to go in a little bit further to understand the eligibility process for CAPS. Here you can see the initial eligibility requirements and ongoing eligibility requirements in the third and fourth columns. So you can see here that families, a family of 3 would meet initial income eligibility if they made $60,584 or less. But this does not automatically mean that they will receive CAPS. So in order to receive CAPS, they must meet this initial eligibility requirement based on income, and then meet an eligibility requirement by being in one of 13 priority groups. So some of these priority groups would be children who are in de facto custody, families experiencing domestic violence, families with children with disabilities, student parents, families with children enrolled in Georgia's pre-K program. So we see also there's the very low income priority group in the second column. So if folks who fall into that income level will be able to receive CAPS. So to look at this at a more local level, we collected parent and caretaker surveys. And we found, so the folks that were income eligible in Chatham County are represented here in blue. And we can see that those folks would meet that initial income eligibility that we saw in the third column of the last chart. But only the folks represented by red were actually utilizing CAPS. So about 12% of the folks who are income eligible are actually utilizing CAPS, and about 55% of those folks were not eligible because they didn't meet requirements in priority groups. 21% hadn't even heard of the program, and may not have met income. They met income eligibility requirements. They may not have met priority group requirements had they applied. So we can see here that there is a large gap in the number of families that do meet that initial income eligibility and the number of folks who are actually able to use CAPS. And so I will speak a little bit to what 9 to 5 is doing to address this as well. So one, we are working in coalition to set community-wide goals for children and assessing funding needs in order to determine the funding that we need to reach these goals and to address these gaps in the benefits cliff. We're researching and implementing successful public funding initiatives to support our children and advocating for increased investments in our childcare system and into subsidy programs. We're also working to develop leadership amongst those who stand to benefit the most. So we're working with parents and childcare providers to provide public education on the childcare system, on CAPS and the public benefits cliff, and giving parents and childcare providers the tools to advocate for policies that will support them and their economic security. So additionally, 9 to 5 is focused on supporting family, friend, and neighbor care providers. And if you remember from the initial definitions, family, friend, and neighbor care is an informal type of care provided by a family, friend, or neighbor, and this can be provided with or without pay. So oftentimes, family, friend, and neighbor care offers a much more affordable option for families. And many families who fall within this benefits cliff will turn to family, friend, and neighbor care if they cannot afford the cost of sending their children to a childcare center or a family childcare home. So we are doing work to support family, friend, and neighbor care providers, make sure that they are prepared and have the resources to provide quality care, and supporting families who are turning to family, friend, and neighbor care when other types of care don't meet their needs. So please feel free to reach out to me if you have any questions or if you would like to discuss the work that 9 to 5 is doing further. My email is here and 9 to 5 social media is also here. Thank you very much.
Thanks so much, Erin. So now we're going to turn the presentation over to Mr. Alex Reuter, who's going to talk about the benefits cliff and the code tool.
Thank you very much, and good afternoon, everyone. It's great to be here today. I think we've had so far today, a very good introduction to the benefits cliff issue overall. We have a good introduction to some of the major programs that affect families, such as SNAP and the child care program. My comments today are going to focus more specifically on tools that are available to practitioners, coaches, policymakers, community leaders, employers to, number one, understand this benefits cliff locally, specifically in your county, but also coaching workers, having trained professional coaches work with workers that are seeking to either increase their financial stability or move up a career pathway, and how they manage their budget and the loss of these programs as they advance. And that's going to be the focus of today's talk. I'd like to just open up by letting everyone know why the Atlanta Fed is working in this area and providing tools to partners such as Step Up Savannah. It really goes back to the comments of our Executive Vice President and Director of Research that he made a few years ago in a Human Services Summit in the Northeast. And you can see that quote on the right side of your screen. It says, "Our goal is that every single person in the United States of limited means has access to exactly the same financial planning resource as every person of ample means." So what does that mean? That means that part of this project, and what you're going to see today, the code tool, really started out with a vision to take the financial planning tools that were available to the highest wealth families, re-engineering them so they're available to all families. And that was the origin of the code tool that you're going to see in just a few moments. The goal of our overall initiative, the Advancing Careers Initiative, is simple and direct. And I'll read this out for everyone as well. We seek to improve economic mobility and resilience by eliminating barriers to career advancement caused by the loss of means-tested public assistance and financial insecurity. We do that by working with partners such as Step Up Savannah, by providing tools and research that can help our partners address this issue in a variety of different ways, from coaching to community partnerships, to working with employers and other tactics. The Advancing Careers Initiative does this work in several ways that I just mentioned. On this slide, you can see the underlying engines that drive this work. And there are two core products that do this. Number one, we have the Federal Reserve Bank of Atlanta Policy Rules Database. That's a comprehensive list of all major federal and state programs that could affect families with the benefits cliff. So that database allows us to produce the tools that our partners use. Those tools, such as code, are powered by what we call the Career Ladder Identifier and Financial Forecaster, CLIF. You're going to see that logo in the slides quite a bit, CLIF. That stands for the underlying technology that drives the tools that we provide to our partners. So again, you're going to see the CLIF infrastructure, which is powering the code tools that our partners in Step Up Savannah use. So these tools are actually driving a number of different activities. You can see those activities on the right side of your screen. Of course, the Atlanta Fed does research on the benefits cliff, and we have a lot of papers about the benefits cliff on our website. We work with community, state, and federal partners to analyze policy solutions. That is, partners that are interested in changing a program or a policy. They want to see what the effects would be. We're happy to do that analysis and try to really understand what the impacts on families would be. Career and financial coaching solutions. Of course, we work with partners that want to provide tools to workers that are trying to plan career advancement in the context of benefits cliffs. Finally, we do an expanding amount of work with employers and provide a very specific tool for employers to use to better understand how these issues affect their workforce and potentially develop solutions to address those issues. And then finally, guaranteed income pilots. These tools are actually used now in many guaranteed income pilots around the country. For those of you that are working or interested in guaranteed income pilots and you need a tool to really provide that informed consent to participants, please reach out and we can set up a meeting. Now, before we transition into the code tool, I want to offer a quick comment about why a comprehensive tool like Code Planner is important. So on this slide, you can see a very typical presentation of the benefits cliff. This is in Georgia for a family with 2 children on a pretty typical profile of public assistance. This slide is showing you income on the bottom, going from $0 to $100,000, and then net resources. So think about that as your disposable income on the vertical axis. That dashed black line is the break-even. So if you're below that dashed black line, it means you do not have the financial resources to cover your basic expenses. So you can just see this family here going from $0 to even $60,000. There's a number of what we call a benefits plateau, which is a kind of a flat area. You know, you're earning more, but your well-being is not going up. That's a stagnation. And then I think we can all see the benefits cliffs at about $52,000 to $53,000 per year. Key takeaways: this family is going to have certainly some financial unpredictability as they move up their career ladder. The question I want everyone to ask themselves is, what can a worker do about this? Where can they go for assistance? If you think about the menu of services available to families, there's actually a bewildering amount of different services that could be used to address this issue. And unfortunately, they're typically not available in one place. There are exceptions there. This slide's just showing you some examples of the different services that are available. Job search and placement services that a worker could go to, maybe career advising. Maybe they could go to a partner that could help address their life issues, maybe getting transportation assistance, maybe getting childcare assistance and connecting them to community resources. Benefits counseling on the lower right. Maybe they're able to go to a caseworker or a benefits specialist who can guide them on what exactly are these very complex rules that are going to affect them as they move up the career ladder. So there's a lot of different options here, right? Just on this slide, where can a worker go to get this comprehensive information? There's even more specialists that are likely not going to be under the same office or roof. There's financial counselors, there's financial coaches, there's financial planners. Every one of these different organizations will probably have different tools and insights to help a worker navigate that very complex benefits cliff picture I showed. And I think one of the things that certainly all our partners recognize is we need to think about better ways to kind of coordinate all these different services to help workers address these issues from all these different angles. The code tools are meant to provide a set of tools. It's really a suite of tools that can address a number of those different specializations we just saw. So this slide's showing you the 4 tools in the CLIF. Remember I said the CLIF is the underlying engine, suite of tools. Step 1 tool is called the calculator or the snapshot tool. That's meant for workers who are more in the stage of their career where they're just trying to get more financial stability. Maybe they just need to get a job, right? They're not ready for advanced career planning. They're not ready to think about an education path in college, for example. They just need to move into employment, and they need a tool to help them with that stabilization step. Then we actually have a Step 2 tool, really 2 tools in the Step 2 suite, that basically say, once a coach or a worker thinks they're ready to start thinking about career planning, right? They're working with training providers, they're working with a local college, they're ready to start thinking about moving into a new job and career ladder, and they need tools to help them make that decision and plan for that decision. So that's where we bring in the code dashboard and the code planner you're going to actually see some screenshots from that code planner today. Finally, we have this employer tool that's more focused on, again, the employer as an end user. I recommend, if you're interested in that tool, reach out to our partners at Step Up Savannah, and we can have a conversation about how you as an employer could use that tool to analyze the benefits. Finally, before we actually go into the planner, I just want to say, for any organization that adopts the code suite powered by the Click tools, you're actually going to get guidance for your coaches about how to use these tools and when. So again, all you see on your screen right now is the example flow chart that we ask coaches to go through when they're working with a client. Where are they on their career journey from crisis to thriving, from crisis to self-sufficiency? What do we need to do to serve them given their current needs? This flow chart's just basically allowing you to know that it's not just an unknown which tool you should be using. We carefully want to work with our partners to help them make sure they're using the right tool. Okay. Now let's briefly just look at the code planner. I just want to go through a few screenshots to give you an idea of how this tool can help workers budget and then move into new careers. So let's briefly imagine we're working with a young parent. This is our standard case study that's based on a real person. Let's say we're working with a client named Leah, 25 years old, lives in Savannah, has 2 children, ages 3 and 5. Let's say she's working in a near minimum wage job and actually wants to go into IT, right? Information technology. And we, as professional coaches, let's all put on our coaching hats, want to help her make that transition. Is it going to be good for her? Will it pay off? What are some of the barriers along the way? So one of the powers of the code planner is it's an embedded career planner and benefits cliff calculator. So we're going to assume Leah is on a pretty standard public assistance bundle again, food assistance, healthcare assistance, Medicaid, childcare subsidies, and tax credits. And we're going to explore how this new IT career will affect those programs. This is the homepage of the code planner. You can see that on the top, there's a few different screens we're going to go through. We're going to choose careers, we're going to compare careers, and we're going to budget. The first screen just starts out asking for basic demographic information. This is going to allow us to create precise estimates of public assistance based on your family type and geographic location. The next set of options on the tool are going to allow you to actually choose the IT career that you want to select for this client. And all the information is local. It's all based on the Bureau of Labor Statistic wages. And you can see on the screen right now, you can compare up to 2 different careers at the same time. After these are inputted, so again, remember, we're going to compare information technology to a part-time job. We would move on to the compare careers screen, which you can see highlighted up top. And we'll then be able to see the actual analysis to walk through the client. So the first piece of information we're going to want to show this client is just how much better off they're going to be in terms of earnings in their new job, computer support specialist, which is on the right, versus the part-time job. And you can just really clearly see that our conversation with the worker will be able to say that over the lifetime in your new IT job, you're going to make about $1.2 million. If you stay in your current job, working part-time, you're actually going to make only about over $300,000 over life. So on just an earnings perspective, you're much better off in this new IT job. Now let's bring in, we've already talked about living wage today. Let's actually overlay these careers onto the living wage. So this slide here has actually been identified as one of the most impactful that we have in the tool, is it takes these careers over time. So you can see we're now looking at Leia's career from age 25 to 50. We can see the two careers. The gold line is that entry-level job, and the red line is the IT job. But now we have that gray line, which is really the living wage. And we can see how this job is going to get you to that living wage. And we can actually see in this instance that while the red line is much better in getting much closer to the living wage than the gold line, we're still not quite there. We're going to probably eventually have to think about more career advancement strategies to get that worker to the living wage. Because we can see here that it really doesn't cross the living wage line to about age 39. Right? So even in the IT job, it's still going to be you're much better off, but it's still going to be a journey to the living wage. Now we're going to go into the real power of the tool, and that is just budgeting for the career advancement step. This slide here is showing you the budget for your career move functionality. So this is going to allow you to work with a worker, add in any additional income or assets they have, choose all the public assistance programs they're currently on, so you'll be able to see what the impacts on those programs would be. You would be able to add in the worker's individual expenses if you want to budget with that worker and plan out their expenses over time. And then you're going to be able to compare the careers with all this information included. So remember, everything we looked at before did not include public benefits, did not include expenses, but now we're able to look at it holistically, which is the real power of the code plan. So in this next slide, this is the key piece of information right here. This is Leia's budget over a 5-year horizon. If the key line on here is 0. If you're below 0, you're deficit. If you're at 0, you're able to cover your basic expenses. If you're above 0, you actually have a surplus. So what this budget line is telling you is that our current job, of course, in that near minimum wage job, we are far below budget. And in our new career from years 1 through 5, while we're not quite at the full budget break-even point, we're very close. So the good news here is that this new career is moving that worker very close to being able to cover all their basic expenses at that living wage standard of living. And so this is, I think, a positive view here. The one note of caution I would add to this worker is that it seems like this line stays flat for a few years, years 1 through 5, and we would call that a benefits plateau. Remember, stagnation. So right away, I think the message here is that the worker's better off, but we're going to have to start thinking about additional career advancement steps so we don't run into this stagnation over the short term. The tool breaks down all the information about their take-home pay, their public assistance, their living expenses, any other expenses they would have as well, such as student loan repayments by year. So you could actually break those down with the worker. We're not going to go through everything in detail, but I just want you to know that this information is there for you, so you can precisely have that conversation with the client. Visually, the tool also will show you graphically for your client what is the actual dollar amount of the public assistance you're going to get over time. So this is just showing us for that same 5-year horizon, what is the amount of public assistance we get over time. And I just highlighted here that immediately, I think for this worker, you're going to see that going from the current job into their new path, year 1 job, that orange block disappears, and that's SNAP, which we've already heard about today. So this worker is going to have to manage losing SNAP right away in that new higher paying job. So all we're doing now is being able to carefully show this information to the workers so they're making the informed. Finally, I just wanted to show you in our last slide what would happen if that worker stayed in their current job. And you can actually see that their current job, if they stay in that near minimum wage job, their budget is not looking good at all. Even if they go to full time, their budget deficit is at least going from about $3,000 to about $5,000 per year. So the status quo is not really an option, but getting into this new job is a much better prospect in terms of living wage and the budget, but we still have to do some planning for career advancement over the short-term horizon. And that's what the code planner allows coaches to do with their clients. So thank you very much, everyone. There's a couple other resources in the slides for anyone that wants to think about training for these tools, which is provided. This is the Advancing Careers Academy. that we provide free training to any coach or partner that wants to use these tools. And again, I recommend reaching out to Step Up Savannah if you're interested in these resources. So thank you very much.
Thanks so much, Alex. So now we're going to turn it over to Mr. Gene Patnode at the New Hampshire Department of Health and Human Services to talk about some of their solutioning.
Great, thank you so much, Kimberly. So fortunate to be here with all of you today. My name is Gene Patnode, and I am the Workforce Administrator for the Division of Economic and Housing Stability at the New Hampshire Department of Health and Human Services. Within the Division of Economic and Housing Stability, there are 4 different bureaus. We have our Bureau of Family Assistance, which is our Eligibility Bureau. There is the Child Care Bureau, the Housing Bureau, and the Bureau of Employment Supports. Today, I want to talk to you specifically about the Whole Families Approach to Job initiative, which has been a very large undertaking that has been going on here in the Northeast region of the state. It's an initiative called the Whole Families Approach to Jobs, and the co-leads for this initiative have been the National Conference of State Legislators, the Administration for Children and Families at the Region 1 area, and the 6 New England states here in Region 1, which is the Northeast. The goals for the Whole Families Approach to Jobs have been to identify program and policy alignment opportunities at the local, state, and federal levels to improve economic stability for low-income families, support state-driven policies and system changes that improve success in education, training, and employment, and to create a regional learning community to develop a shared best practice policies and system reforms. Connecting health and human services with workforce. This is something that we've been extremely focused on here in New Hampshire, but working with whole families results in a better employment and family outcomes. We have taken an approach where, while we're looking at different poverty reduction strategies, existing policies, procedures, and rules that exist at Health and Human Services here in the state of New Hampshire, putting families in the center of the work that we're conducting and doing is critical for decision-making. Current focus on state-based solutions and initiatives, looking at the social determinants of health, inspiring focus on prevention in Health and Human Services. And certainly with the tight labor market pools comes greater opportunity to bring parents into the labor market and help them advance and achieve upward economic mobility. So what's different about the Whole Families Approach to Jobs? Again, I mentioned putting families at the center of the solutions and decision-making process, program, and system design. Bringing state teams with cross-stakeholder approaches to ensure policy changes reflects constituent interests, parents, business, government, and shared values. Commitment to poverty reduction strategies, holistic practice, and reducing obstacles. And last, interplay between federal and state policymakers can be addressed through the National Conference of State Legislators and our ACF partnership. Whole Families Approach to Jobs, uncommon partnerships. We felt as though it was very important to illustrate here in this slide some of the teams that are comprised of developing the Whole Families Approach to Jobs from both the national, federal, and state perspectives. So state teams were comprised of legislators, executive branch leaders, parents, business, best practice organizations, and philanthropy. Work groups that have been implemented and in place to conduct this work were on the benefits cliff working groups, early childhood education, work and the workforce, engaging parents, strategies for state agencies, and looking at work requirements. helping families climb the economic ladder by addressing benefits cliffs was certainly 5 areas of focus when engaging in this initiative. We set out to map benefits cliffs, a couple bullets under that: self-sufficiency standards, benefits calculators. Alex was just talking about that. Aligning eligibility levels, looking at asset limits, income disregards, alignment of rules across programs, making work pay, utilizing tax credits for working families, looking at career pathways. 4, increasing family economic security through asset development, looking at escrow accounts, individual development accounts, and others alike. And then 5, fostering cultural and system changes in the public and private sectors: employer engagement, cost benefit analysis, goal setting, career planning and coaching, and student access to SNAP. In this slide here, moving from the national perspective and the federal perspective, I want to kind of boil it down to what we've been doing here in New Hampshire. In this slide, it's an illustration of the whole family's approach to jobs governance and structure that we developed here in New Hampshire. And as you can see by this illustration, again, the families are in the center of the work that we're doing. We have support in the green there from the national perspective, Region 1. But then when you continue to go to the right counterclockwise, we developed a state chapter that was comprised of various state government agencies, philanthropy, business, etc. And we also developed what we House Bill 4 Cliff Effect Legislation Working Group to begin to look at strategies and legislation that we wanted to change in the state of New Hampshire. From there, we developed in the pink state chapter subgroups, and those subgroups brought in experts in the areas of workforce, childcare, transportation, and housing to help inform our legislative work that we're doing here in New Hampshire. And then we had in orange the Hhs Integration Team. This integration team focused on the redesigning of policies and rules that in some instances were over 33 years old in our state of New Hampshire and that desperately needed to be reformed and looked at. And then our constant HHS leadership and ACF technical support that we had along the way of doing this. So I just wanted to paint this picture here for all of you. The whole family's approach to job, parents working, children thriving. This is kind of our theme here in New Hampshire. And the goals were to strengthen and expand our New Hampshire chapter team, which we've done, to establish a focus on solving the cliff effect in legislation, connecting with other key initiatives and aligning outcomes, and conduct a comprehensive economic analysis here in New Hampshire, which we've done. And these are all an effort to continue to disrupt poverty, to look at multi-generational frameworks, again, continue to put families at the center of the policy making that we're doing, incentivize work here in New Hampshire, boost individual effort and responsibility, promote efficiencies in government and multi-sector partnerships. You can see here, I won't go through all of them, but these kind of social determinants to health were all part of our decision-making when looking at existing legislation and policy in New Hampshire. Some of our key elements, again, I mentioned the social determinants of health, benefits, the business climate. You can see on the right, the areas within HHS and within the Division of Economic and Housing Stability that we specifically were looking at were our TANF programs, SNAP, housing, childcare, transportation, our WIC, energy, fuel assistance, all were all part of our reform and redesign when looking at cliff effect strategies and continued work around supports for this endeavor. Yeah. There's a quote here on the right, and we see people who don't take promotion or who quit their jobs because the loss of public benefits. People won't take the opportunity to work full time. This is detrimental to their long-term stability and the business stability we deal with, churn and overturn. So this was a comment made by a large employee in New Hampshire. And it couldn't be more true. Individuals that are participating and taking advantage of our TANF and SNAP programs, they know oh too well that when they take on a job, the loss of public benefits that they're going to incur or that they would have incurred just does not make sense to them financially and when moving on. So we had to take a close, hard look at these things. And the Whole Family's Approach to Jobs work group produced a 6-state New England benefits cliff brief back in 2018, where all the Northeast regions of the country got together and started looking at these things. I'll point out New Hampshire developed, thank you, exploring a range of policy reform options related to the benefits cliffs to include income earned disregards, increased asset limitations in New Hampshire, increased childcare, SNAP, housing, and transportation, along with post-TANF supports. And I want to talk about that just for a few seconds. The income earned disregard, going back just a little bit, here in New Hampshire, we've developed a brand new pilot that is going to be starting October 1st. And we're going to be launching it, and we're going to be doing a 2-year, 100% income earned disregard, meaning that any individual that takes on new employment will be able to keep their TANF cash assistance benefits for 2 years while employed to help them actually slope off the cliff. And to what Alex was talking about a little bit earlier, to talk about increasing an individual's career advancement as they enter into new jobs. It's just one area that we're working on that we're very excited about here in New Hampshire. And I can talk a little bit more about that later. Some things I wanted to put out, the support of our Governor Sununu here in the state of New Hampshire, resulting in new HB4 legislation. Some of the bullets that were outlined in that white paper were about mitigating the cliff effect, how it resonates with our core values, assuring economic strength for families and businesses, bolstering job choice and success for parents, incentivizing work, promoting efficiencies, helping parents work and children thrive through rapid local access to supports, meet and fill the worker shortage here in New Hampshire, anchor sustainable employment, and below, you'll see that some of the things that we're doing to lead the way here is, again, to look closely at the social determinants of health, work with recovery-friendly workplace initiatives, the benefits cliff work that we continue to address through our chapter work. We developed a comprehensive economic analysis here in New Hampshire that helped to inform new legislation. And some of the things I mentioned earlier, our governance and structure, we developed a public benefits cliff calculator. Alex was talking about that. We've rolled that out here in New Hampshire, and that's been tremendously beneficial. And engaging business and stakeholders along with philanthropy with all of the work that we're doing. I provided a couple of resource links. This was an expedited presentation, but this goes into, if you went to these links, you'll see a host of initiatives and work that has been going on in this space here in New Hampshire for anybody to look at and take advantage of. So thank you very much for your time. If there are any questions, I can certainly be happy to answer them at the end.
Awesome. Thanks so much, Dean. All right. We'll quickly move into Livewell Erie. We have two presenters, we have Ms. Jacqueline and Ms. Marie.
Good afternoon, all. We're excited to be here and part of this great conversation. We do recognize that the time is getting short, so we're going to shorten our presentation, and really, I'm just going to provide you with the meat of the program. And so all the speakers talked about the benefit cliff, and Alex from the Atlanta Federal Reserve talked about using a benefit cliff calculator. And so what we did is that we're in New York State, so we're just a county, one of 62 counties in New York State, and we have something that our county executive Mark Poloncarz has put into place called Livewell Erie, and it really is a vision where no one is left behind. He actually put on the table $10 million, and he said to us, you know, we really want to do some anti-poverty work, and we said we want to do something a little bit different, because there are tons of anti-poverty programs that we have not seen the kind of outcomes that we would expect. And so we proposed this Livewell Erie Workforce Development Program, and here we have about 5 goals listed. And first of all is to provide a pathway to upward mobility, support participants to successfully transition through the benefit cliff. You can actually stay on the first slide. Identify the factors that help people be successful and look for opportunities to scale up, and policy advocacy. And I know Jean just talked a lot about some of the policy advocacy that happened in New Hampshire, and that's the work we're looking at. So what is Livewell Erie Workforce Development Pilot Project? It is a comprehensive approach designed to help individuals receiving social services benefits overcome workforce barriers and the benefit cliff and transition into higher paying job opportunities. This program effectively brings together available workforce development community resources and supports them through a set of short-term upskilling opportunities, wraparound, and supplemental services. Let's just go back to the very first slide, which had the Livewell Erie, the goal, the employers. So those are our goals. So who are the participants? We are looking at 100 to 200 participants who, again, are receiving some kind of public assistance, which Ife and Aaron talked about: childcare, SNAP, temporary assistance, HEAP, any public benefit program. That's one of the eligibility criteria. And then, but we're also looked at folks who were underemployed. They're already employed and they're ready for promotion. The last quote that Jean talked about, where one of the CEOs says, we have folks who we would like to promote, but they turn down the promotion. We have had those same conversations right here in New York. So this isn't anything new to any of us. So those are the participants. And the reason why we chose folks who were already employed, because the timeline, this is only a 2-year pilot project, and we really wanted people who were already working and really just were looking for the career pathway and the promotion. So our timeline, we started in April of 22 this year, and we'll end up in April 2024. The funding came from, we actually received $10 million to implement this program, and it is local dollars. The reason why I want to highlight that is because when it's local dollars, we can use it any way we see fit. There are no, we don't have the strings attached to it. We don't have the eligibility confines. This is local dollars that can be used any way to support this program. And so those are, I told you about the 5 goals we have. And first of all is really providing a pathway to upward mobility. Then the employers, we worked with Buffalo Niagara Partnership, who is a consortium of employers of all employers, but definitely the largest employers in Western New York. And they did a lot of work of already identifying the 5 sectors, which include manufacturing, technology, customer service, healthcare, and hospitality. And those are the 5 sectors that had opportunity for growth and a career pathway and opportunity for promotion. And so we've been working with our partners, our employers, and we've said to them there were 2 things that they have to bring to the table. One is that it has to have a career pathway where folks who are already employed there have opportunity for promotions that are already identified. The second is that they had to provide living wages because we were not looking to support any minimum wage opportunities. It really had to be that at some point with the training that people would receive, the upskilling, that they would be able to move into a career. And so our innovation partners, I'll start with Goodwill first. Goodwill is one of our local, thank you. Goodwill is one of our local agencies. They are our anchor organization. They house the career coaches because there are two things that we thought was important to this because we really thought about this in a holistic approach is that we needed career coaches. That's identifying and doing the evaluation and assessments on the skills, what are the skills that are needed. They also already have a program that provides the upskilling and already have a training program already in place. So they're our anchor organization. They provide the career coaches. And then so our innovation partners, we have 4 other partners, and that's where our life coaches live because we needed this to be holistic. We needed the career pieces. We needed to know the available skill development, the training programs, but we also know that we're asking people to take a leap of faith, transition through the benefit cliff. Some of them are going to lose their benefits. This has been well established. This is what the benefit cliff is. But what we do is that we use the life coaches use the benefit cliff calculator so we will be able to very specifically identify when somebody is going to lose their SNAP benefit. So we know what their wage increase is. We know when they're going to begin to lose some of their SNAP benefits. And then what we're doing with the money, the $9 million that we have 10, but we are using the $9 million as our supplemental funds so that if a person loses their child care assistance, we will use the funds to pay for the child care assistance directly to the provider. If they're going to lose some of the SNAP benefits, we have put into place where we can supplement to the grocery stores so that it isn't money coming directly to them and they have a negative tax impact. But then we're just using those dollars to subsidize what they have need of. So if it is they have a car, but they cannot afford their car insurance to get to an employer who is willing to promote, then we'll be able to use those funds to support that. And all of that goes through our Goodwill partner. And so that's how we're helping people get through the benefit cliff. And we are asking them to take a leap of faith, saying that we know they can do a short-term upskilling program, a training, it could be LPN, whatever it is. We already have identified the wages that are needed based on their family eligibility, their family makeup. We know how much money that they need. And so our innovation partners are the service providers. They actually do the life coaching. We absolutely had a focus on the social determinants of health because we know that people cannot go to work if they're concerned about where they live and how they live, if their education, their child's education. So all of that is living within the innovation partners, the financial literacy education, because now people are budgeting differently, and we're doing a whole series on that and training around what does it now mean to budget for every dollar that you have as it relates to you're no longer receiving assistance, setting life goals, monthly case conferences. So that's our innovation partners. Our next one is our training. Again, I talked about the financial education, the Goodwill, going back to Goodwill career coaching, the assessments, all of that. That's where all the career pieces happen with Goodwill. This one is a quick one. So I just want to highlight our pivot program. we currently, it's called Persons in Vital Opportunity Training Program. And what we do is we subsidize 6 months of wages if an employer takes hires one of our clients, because we are the local social services district, and we subsidize the wages for 6 months. Taking on somebody like this might be their first time in the workforce. It might be they're re-entering the workforce after a long period of being absent from the workforce. And then so what we did was, for this pilot project, we said, not only will we support the first time, which we will continue to do, that's our initial goal of the pivot program, but when you promote someone, then we will also do another 6 months of subsidized wages, so that will help the employer again be a willing partner and to incentivize the employer for taking on a client, and especially someone when they're moving to promotion. We did all the business need analysis that was done, and this is the perfect time for this program, because I'm sure as many of you are experiencing, there is a great need for employees, and especially we're seeing, I forgot what they call it, the gray exodus, that we have a large number of people retiring. And so the workforce sectors have actually laid out what they're looking at in the next 5 years, how many available jobs, what will the training be. So this is actually a perfect time for this. The participant process, we laid out the program very clearly on what the expectations were, what we would do, how we would support it, because we absolutely wanted people to know what they were getting into. Because again, this program we know people are going to fall off of the benefit cliff, and this program will be the transition and the bridge until they get to the financial pieces where they can handle all of it themselves. And so we were asking people, I think, really to take a leap of faith. So we were very clear on the participant process, because we wanted people to know what they were getting into. The other piece that we put into this is an evaluation piece. Our evaluator is the State University of New York at Buffalo School of Social Work, because we wanted to know, there were a couple things we wanted this program to be evaluated on. What are the factors that help people be successful? What is it in terms of the programming? Is it the career coaching? Is it the life coaching and the needs assessment? And so we really wanted to be able to know what the factors were, and then be able to identify the policy advocacy opportunities, because as a local district, we know that some of the policies that have been in place for 35 years are really counterintuitive to folks being able to be successful. And so they're doing a complete evaluation on each of the partners, including Erie County Department of Social Services, and our Goodwill partners, our innovation partners, our participants, and employers, because we really wanted this to be a research-based perspective and being able to use data to really drive how we're building the program. And we are getting data back already, and it is informing how we're building the program. That is it. I know that was very quick. Jackie, is there anything that I missed? I was just thinking about the time that we had.
Yeah, no, I don't think you missed anything, Marie. I just wanted to point out that since we launched the program, we currently have 9 participating employers who have identified some of their internal staff who are ripe for promotion and are a good fit for this program. We have currently identified 40 participants who are in the screening process, with a full 18 who are actively engaged with either a career coach and or life coach.
Thank you.
Thank you so much, Jackie and Marie. So we're going to move along the presentation. And so we want to talk a little bit about what now. And so Step Up Savannah is engaging in this work to mitigate the public benefits cliff. So we are facilitating a Bridge the Cliff task force that we meet on a bi-monthly basis to talk about some of the issues. We have a strategic plan and goals to mitigate the benefits cliff in our community. We also just launched on July 1st of this year, the Bridges Beyond Benefits Network. It's a Facebook page. You can just type it in, Bridges Beyond Benefits Network, facilitated by Step Up. And this is a network that is, the goal is to bridge the benefits cliff by encouraging community and peer engagement through information and resource sharing. And members can share resources and answer questions in the group. And if you haven't already, I encourage you to join the group, and I'll drop that link in the chat after I get done speaking here. We're also working on events such like this so we can educate stakeholders and policymakers and employers and the community at large. And we're researching and utilizing nationwide best practices. So some of those you've actually heard from today, like New Hampshire and Erie. We've also talked to Missouri, the urban footprint and urban coalition. And so we are constantly looking for best practices around the nation. And you heard about this a little bit earlier that Alex was talking about, but in June of 2021, we launched the Career Opportunity Dashboard for Economic Mobility that compares public benefits along chosen career pathways. And you heard about that today, but that's another thing that we are doing. So what now? So now we are looking to evaluate program requirements for continuing to translate data from our Bridges Beyond Benefits survey. We are utilizing code. We are creating programming aimed at mitigating the benefits cliff with the nonprofits and social safety net. We are wanting to expand connections to the LMI community, formulate bridging capital to get them from public benefits or poverty to self-sufficiency. We want to enhance programming so that it's effective for these transitional resources, and just try to look for funding and funding awareness to provide some of these transitional services. So now, before we get into Q&A, we would like to discuss how you might help. So we would like you to promote and join hands with community assets, just making sure that people are understanding that bridging capital. Join the Bridge the Cliff task force. If you're interested in that, you can contact me, and I can drop my email in the chat as well. And if you're interested in joining and just joining in on that work, it is comprised of the community, people who have lived experience. We have social safety net providers, we have employers, and we're looking to grow that group. So if you're interested, just contact me and we'll get you connected. Educate your social circle. So now you know a little bit about the benefits cliff. So now take this information and share. We learned when we did some listening sessions with the social safety net and the community that folks didn't understand the implications of the benefits cliff. And so it's important, the first step to any change is education and understanding. And so just share information, get involved in the B3 network. We're looking to grow that group. We're at about 70 members, but we're looking to expand to thousands so that it can be most effective to the community. So now we're going to turn it over to Q&A. And Austin, are there any questions?
We don't have any questions written down right now.
Okay. All right. Is there anything that we missed from any of our partners that you want to emphasize to anybody that's listening today?
I think one of the most important things we also want to take away is that we can't program our way out of poverty. We need some systematic, sticky policy solutions to help address some of this. And so as much as you can, as Kimberly mentioned, to educate yourself about the public benefits cliff, share this information with your circle. But the best way to change the outcomes for people living in asset poverty today are to advocate for people-centered policies that actually use means funding intentionally and with future long-term investments in our communities. And that's at the local level, the regional level as well. We certainly want to thank all of our partners for participating and want to open the floor for them to add in any additional information that they would like at this time. Thank you for joining us. And Kimberly, would you like to close us out?
Absolutely. Again, like Alicia said, we'd like to thank all of our partners for joining us today and making this a reality. You can also follow Step Up Savannah on all the social media channels, as you can see on the screen. Just click in or type in @StepUpSavannah, and you can also check out our services at stepupsavannah.org on our website. We would also like to thank our funders that are here on the screen. We could not do our work without you. So if there's no questions, we will conclude this presentation.